Mwiseneza Emmanuel. I'm here representing group number 4, where we are going to discuss about the project which is entitled Identifying and Managing Risk Affecting Women During Childbirth in Gakenke District. We are a number of 6. We have Mwiseneza Asimwe, Wimana Gihozo, Mugwaneza, and the Nyangwi. For the background of the project, as I said, our case study is Gakenke District. So our project is focusing on identifying and managing risk affecting women during childbirth in Gakenke District. Gakenke District is located in the northern province of Rwanda, and maternal and neonatal health remains a critical public health concern in Gakenke District because access to quality healthcare services is limited. Although Rwanda has made a significant progress in reducing maternal mortality through investment in healthcare infrastructure, community health programs, and improved access to neonatal care. So this project is aiming at improving delivery outcomes by identifying the risk that hinder safe childbirth. So our goal is to help local health authorities, NGOs, and community-based organizations design targeted intervention to reduce maternal and the newborn complication and death. So we really understand that to reduce or to tackle this issue, we need a combined effort of all different stakeholders who may come and join their effort to see how we can go to a better living of our community. I want to invite my colleague for the next slide. Thank you.
Thank you so much. We are going to look at the challenges that is on our topic about what affect women during childbirth. The challenges that we can discuss about in the district. The district is mountainous with hilly terrain, which makes transport and access to health facilities difficult. The district has higher materials and neonatal health risks due to topography, infrastructure, and limited access to emergency obedient care. Health infrastructures. Gakenke has several health centers and one district hospital. However, the district struggles with staffing shortages, long distance to health facilities, and limited ambulance services. Major hospitals include Gatonde District Hospital in Mugunga sector that has the capacity of 60 patients. Nemba District Hospital in Nemba sector, church-owned facility accommodate 178 beds and serve to 260,000 people. Certified by 10 doctors, served by 10 doctors, 64 nurses, 13 midwives. Service include gynecology, obstetrics, pediatrics, surgery, emergency care, and given the population of 365,291, where female are 192 and 692, making it 52.8%, it is evident that the district has limited number of hospitals, equipment, and staff to serve mothers. Thank you. Risk, we are going to look risk identification. To identify risk affecting women giving birth in Gakenke district, we are going to use 2 projects: risk identification, brainstorming, and fishbone or Ishikawa. Let me inform my colleague to continue. Thank you.
Also, we're going to look at brainstorming. Under brainstorming, we conducted this session with first professionals, midwives, patients, and local leaders. And in that exercise, we identify some risks, which resist transportation barriers, poor roads, and lack of facilities, which lead to delay in accessing health centers. Second one, we have low health literacy. Some women may not understand the importance of international visits Another thing is cultural beliefs, where some women don't traditional practices may discourage giving birth at the house facilities and we don't follow the rules of going to the hospitals. Another thing is shortage of medical staff. Health centers may lack skilled birth attendants. There is also stock out of factories, essential drugs, or delivery kits may be unavailable. And lastly, we have poor communication system, delays in relying emergencies to hospitals. Thank you. I can call my colleagues to continue from here.
Hello to everyone. We're going to proceed with another. Hello everyone, we're going to proceed with another disk identification tool, which is cause and effect diagram or fishbone, or also which is known as Ishikawa diagram. And it is a tool used during disk identification to understand the root cause of a disk. It helps us focus on not just on the problem, but on the underlying cause that lead to it. It is called the fishbone diagram because it looks like a fish skeleton, where the head is represent the main problem or the disk, and also the bones represent the possible causes or that lead to that problem. And that's why we have this diagram which look like a fish, where we have a head and also another bones, and there is another specific bones, those small ones which is found in the main causes of the problem. And here we're going to discuss about some key methods key issues that we find as our bones. And here I'll just talk about some of the three that we took from our case study, which is manpower, where in the case study that we have, which is from the Gatenye, maternal and neonatal health, we found that there is an issue of manpower where there is inexperienced staff like nurses and midwives, and as you have seen the numbers from the challenges that we have found in our case studies, we have found that they have low number of staff, but the demand is high. Like the supply is very low, but the demand is very high considering the number of patients that they have. As you have seen, that it's around 200,600 people who need services, but still we don't find enough staff who are going to help them to find the services. There's also overworked medical staff due to understaffing, and those people can also lead to challenges since they are so tired just to deliver the services. And there is methodology they are using, the poor referral procedures, there is inadequate birth preparedness and education, means of transport are not appropriate, like people are coming from different sectors, but the district is not also with a good infrastructure where people can find the easy ways like board and the buses, so it's become hard for them to reach at the hospital, which can also become the main causes of the issues that we have, the main problem that we have, which is maternal and neonatal death. And also there is another issue of machine and equipment where there is non-functional delivery beds, there is lack of ultrasound machine. These are also one of the tools that we use where people are delivering or during the hospital. There are key materials that is needed, but here at the Gatenye Hospital, from the case study that we have done, it shows that the machines and equipment are not they're not good. So I will also call my colleague to continue with the next part of this cause and effect diagram. Thank you.
The other issues are to do with materials. When it comes to materials, there's a challenge of insufficient delivery kits. These are kits that are used during the childbirth of women. These are the kits that the doctors and the nurses use for the same. And they're not sufficient because the hospital doesn't have enough. The other issue is the lack of blood transfusion supplies. They don't have enough blood in their blood bank, which makes it very difficult to provide blood transfusion to mothers that have lost a lot of blood during childbirth. The other issue that we tackled here, the other cause, is the measurement issues. Because they don't have enough data in their capacity, and it is not easy to measure the number of, for example, pregnant women that have issues with childbirth, and even the ones that die during the birth process. So there are no specific measurement requirements that are used for the same, which makes it difficult to make statistics and even come up with proper reports that evidence this. Lastly, they have insufficient budget to facilitate hospital development. And as a result, most of the items, for example, to do with the delivery kits and other key items cannot be purchased since they don't have enough money in their budget. Thank you very much. Let me call upon my next colleague to conclude.
Thank you so much. Let us come by conclusion. Conclusion, we are going to base on the two things, brainstorming, where we can say that we generate a wide range of risk quickly with stakeholders input, fishbone or Ishikawa diagram, cause and effect. We systematically identify root cause and categories risks. These tools help health planners in Gakenke district to develop targeted interventions such as improving roads, training midwives, and securing equipment to reduce maternal and neonatal risk during childbirth. We can continue with the references where we will invite our colleague who want to lead this data in the following references, where we can use such as Gakenke District 2022, Menya Akarere, Gatonde District Hospital, About Us Overview, Nemba District Hospital, About Us and Government of Rwanda, National Institute of Statistics 2022, Habimana P, Nyirazinyoye L, Thompson DR, and Haganira 2021. We have Mnyaneza E, Mukamana D 2021, stakeholders perspective regarding implementation of maternal and newborn health care programs. Thank you so much for your kind attention.